After evaluation to determine the amount of bone you have available, we can begin treatment with dental implants. We can do a conventional or standard implant, sometimes without doing invasive procedures. But you will still have a long time for healing, the 6 to 8 months, and then you will have your abutment and your crown placed on that standard implant. So it will take a little bit more time before you finalize it. However, if you have the appropriate amount of bone remaining, on the day you come in and after your consultation, you can have your mini implant placed, and you can also have the permanent crown placed because you did a consultation, the workup, and on that particular day, that second visit after your consultation, you could have your tooth replaced with the final restoration.